let's get rolling here. What we're going to talk about is optimizing your urinary health. And again, this is something that has taken us probably a good year just to get this on the screen and get this shared with people. But it's my heart. It really is so important to me because I think it really helps people, and men in particular, with their overall health. So let's get rolling here. Hey, Blair, the next slide here. And I hit next, it doesn't go next. Okay, there we go. All right, so thank you so much for being here. You're on your new way. You're on your way to a new path of health. You should really be proud of yourself for showing up and putting importance in your health. So thank you for being here again. The fact that you're here tells me that you may be having some urinary issues. You may be frustrated with your symptoms and how these things are controlling your life. You may be looking for an alternative to pharmaceuticals or surgery. You may be getting up a lot at night, 3, 4, 5, 6 times at night, and you're exhausted. You can't sleep because you're up all through the night. Or you may be having chronic pain in your pelvis, pain in your prostate, pain in your bladder, pain in your testicles, and it's affecting your quality of life. And a lot of times, you go to the doctor with this issue, and one of the mainstays of treatment oftentimes for chronic pain is antibiotics and non-steroidal anti-inflammatories. And while those sometimes can be helpful, that doesn't necessarily fix that issue. And so we'll talk about some things that can really be helpful in those situations. And then also recurrent urinary tract infections. One of the things that when you have recurrent urinary tract infections, it just tells you your body is not at homeostasis. Things are not working the way they should. And oftentimes something is just off and not balanced. So there are certain people that this is not necessarily the best fit for you, the prostate coach. And this is if you're looking for a quick fix. Western medicine is traditionally geared towards giving you a medicine or surgery, something, quick to give you. This is different. This is a program. This is, a 3 to 6 month program that really teaches you about your health. It teaches you about your men's health. And it takes time. Something like this, where you're looking at really healing your body from the inside out, something like that takes time. So if you're looking for a quick fix, this is probably not the best fit for you. You got to be willing to invest in yourself and make some lifestyle changes. We know so much about health and wellness and things that can really help your life and your health improve, but you got to be able to make some small changes, oftentimes with your behavior, what you're eating, your activity level, things like that. But those things, I always say, making a couple of small changes can really make the difference, and you can really get great results by making these small changes. It's not for you if you don't believe your body can heal. If you think you're stuck in a situation and nothing's going to get better and you've tried everything and you've lost hope, you really got to understand how powerful your body is. Your body has the ability to heal from disease from the inside. And no doubt, you can be healed from a lot of these chronic issues that plague many people throughout. So again, you got to believe that your body can heal. And if you don't believe your body can heal, this program is probably not the best for you. The other is if you're newly diagnosed, if you're just recently diagnosed with something, you haven't been evaluated by a urologist, that's usually where you need to start. Rule out cancer, rule out all these other issues that can happen, because this is really geared towards chronic conditions, chronic issues that happen, in things that we can coach you on and help you with improving your situation through this coaching program. So it's really important that you have a urologist. The prostate coach is not a replacement for your current doctor. It's really looking at being a complementary role to your doctor. And that complementary role involves education. And then, obviously we try to make some changes to improve your life and health. So I'm sharing today with you what's possible if you remove these barriers. There are barriers that prevent everyone from healing. And if we can remove these barriers, your body, no doubt, has the ability to heal. Now, what I've learned is your body is the hero. Medicines are not the hero. Supplements are not the hero. It's certainly not me or any other doctor. Your body is the hero. Your body has that innate ability to heal itself. No doubt it does. And so we're going to talk about urinary symptoms, often urinary symptoms like frequency, urgency, incomplete bladder emptying, getting up at night, chronic burning with urination. These are often a sign, it's often a check engine light. It tells you that your body is not functioning normally. And it's a signal that something is wrong in the body. So your urinary symptoms also, it's not just prostate or bladder specific, but when you have urinary issues, this can, you can have a stroke or a brain injury or a spinal cord injury or other things like that can affect your bladder. So other issues other than just the prostate and the bladder can cause some of these issues. And then you got to talk any of these chronic urinary issues or any chronic medical condition in general. No doubt gut health plays a huge part. And the gut is what controls inflammation through the body. So gut health no doubt plays a part in improving these chronic urinary issues, especially when underlying inflammation is one of the causative factors. So at the completion of this workshop, you will learn some of the top root causes of your chronic urinary issues. We'll go through some simple dietary changes that you can make to heal your issues. And you'll also learn how you can get a personalized program tailor-made for you and your situation. Now, everyone has something different. One guy may have chronic prostatitis. Another one may have interstitial cystitis. Another one may be getting up 5 or 6 times at night. Someone else may have recurrent urinary tract infections. Someone else may be healing from prostate cancer and needs something completely different. And that's why a personalized program is what is needed. You need something that's customized to your specific needs, and we'll talk more about that. So this is me. I'm Dr. William Stiles. I'm a board certified urologic surgeon. I'm board certified osteopathic physician. I've been doing this for over 20 years, and I have lots of experience in the field of urology. Essentially dedicated my life to urology and helping urology patients. I've treated over 30,000 urology patients. I've performed over 15,000 urologic surgeries, and I'm a men's health expert. And I don't say this to brag. It's really just that on the internet, there's just so many people that are not qualified. And, I'm someone that, again, I've dedicated my life to training in urology and really focused on patient care, and giving the best patient care I have. One of the greatest tools I have, I think, is answering questions. I'm able to answer questions and break complex issues down in a simple way that hopefully guys can understand. So that's me. This is my family, beautiful wife, Blair, 2 kids, Willis and Remy, ages 12 and 9. This is my heart. These guys, this is my family. This is why I do what I do. These guys are special to me. So that's my family. More of that, more family there. So, all right. So my mission, helping people achieve sustainable and optimal health and wellness. Health and wellness is more than, exercising and all this, or being able to run fast or run a marathon, things like that. There's so many other factors that involve health and wellness, and we'll get a little bit into that. Now, doctor in Latin, this means teacher. And nowadays, doctors don't teach a lot. A lot of that is because they're just so busy. They're busy professionals. They're great at what they do. They're doing surgery. They're running from patient to patient. And, they just don't have a lot of time to teach. And that's something that I love to do. I love to teach, and I love to talk to people about their health, and have a way to help people with their health. And so, this quote of Thomas Edison really hit home. It says, "The doctor of the future will give no medicine, but will instruct his patients in the care of the human frame, in diet, and in the cure and prevention of disease." Now, I don't think we're there yet now, but in the next 3, 5, 10 years, something like this, no doubt, I think a lot of doctors will be providing this type of care and really giving people true health that they can achieve and continue throughout their life. All right. And the other thing is, so many people think that these urinary issues, they just have to live with it. And they have, that it just comes with getting older, getting prostate cancer, or getting these urinary issues, or prostatic enlargement and all this stuff. Many men feel like that's just what happens when you get old. And it doesn't have to be that way. There can be preventative strategies that you can do that can improve your outcomes. There is no doubt about it. Cancer diagnosis starts 10 to 20 years before it's diagnosed oftentimes. And the same with these other chronic issues like coronary artery disease or other lifestyle related diseases. These things show up 10, 20, 30 years after, after someone has lived in that environment for that period of time. So, I talk about my own health. I was a busy and successful surgeon. I was working a lot. I was working 70, 80 hours a week. I was trapped in a cycle of work and no sleep, exhausted, fatigued. I was giving everything I had to work, but I was empty. I had no time left for my family or myself, for that matter. I was unhealthy. I was overweight, and I had no time or energy for exercise. And like many of you, I went and I had lab work done, and my lab work was normal. And no one had any answers as to why I was, not feeling well and exhausted and fatigued. I had hormone issues. I had digestive issues. I had adrenal fatigue, headaches. I was constantly getting sick over and over. Every few weeks I would get sick. And to make matters worse, I was in a mold infested building. And so I feel like mold no doubt played a role in certainly worsening my exhaustion and fatigue. So I needed a break. And to get my health and life back, that's why I needed a break. So over the next year, I really focused on health. I was eating better. I was exercising. I was stretching. I was getting better rest. But I still was not back to normal. I was doing everything I could, and I still wasn't back to normal. Something was missing. And what was missing was that I found a buildup of body toxins that were wreaking havoc on my system. And it was a root cause as to why I was so exhausted and fatigued. And so then I went on a journey to remove these toxicities, to essentially allow my body to heal. My brain fog went away, my energy increased, my gut health improved. All of these things improved. Now, it did take some time, just like I say, but it allowed my body to heal from these things. And by going through this process, I truly believe that ridding my body of these toxicities essentially, or ultimately, it saved my life. And that's why I feel compelled to share it with you today. Now, as an osteopathic physician, I knew my solution would not come from a pill or symptom care, but I needed a more holistic approach to really get complete healing. So the search for real health. My eyes were open to better ways of true healing, and I started asking a lot of questions. Why was my body not working like it did 20 years ago? Why are the cells of my body not working properly? Why aren't my hormones working as they should? Why is the prostate gland prone to infection, growth, or even cancer? How can we achieve urinary balance or proper function? Can natural supplements be helpful in achieving better health? And then one of the big things is, why are every 1 out of 2 men diagnosed with cancer over their lifetime now? Why is that? 100 years ago, it was 1 or 2 men in 100 would get cancer, and now it's 50%. And then, can we reverse the progression of disease? Are we able to change that course? And are we just victims of our genes and things like that, or can we make these changes and really allow our bodies to thrive? And no doubt what I learned is the latter, which is our bodies are powerful. They want to change, they want to heal, they want to do what they're designed to do. But a lot of times the big factor in our bodies not healing is that toxicities are present, which are affecting cellular health. We are surrounded by toxicities. You can't live in this world and not have these toxicities present. They're in the environment. They're in what we eat, what we drink, the air we breathe, the products we put on our body, the products we use in the house to clean our hands or to clean our hair. These toxins are everywhere, and no doubt they play a role in how our cells function. Now, when these toxicities are there, like I say, they affect our cells. When you affect cells, now you're affecting potentially collections of cells, and collections of cells are organs. So it can have a part in now how our organs function, not only how our cells function. So no doubt clearing the body of toxins is an essential part of optimizing your health and wellness. So, again, you can eat right, run 5 miles a day, do all this stuff. If you are full of toxins, you will not get the benefit of eating right and exercising, again, if your body is full of these toxins. So this is one of my favorite slides. It's from A.T. Still. He's the founder of osteopathic medicine. And it says, if the supply channels of the body be obstructed and life-giving currents do not reach their destination full freighted, then disease sets in. So, in this picture, if let's say there's narrowing of the blood flow to the kidney, that's called renal artery stenosis. If the kidney is not getting the right blood supply, the kidney will not function right. Disease will set in. Likewise with these ureters, the tubes that drain urine from the kidney, if these are blocked, backflow pressure will drive up and it will affect the function potentially of the kidneys. The bowel as well. The colon is the #1 waste removal organ. And so that is always something that is so important, to have those bowels move to rid the body of wastes. So, we also talk about blood flow. So arterial flow, venous flow, and also microvascular blood flow. These are the capillaries, and this accounts for about 99% of our blood vessels, which is our capillaries. So important to get these things flowing. Your lymphatic drainage, something that's probably the most overlooked system in the body. And it's so important. It is like the sewer system of our body, and it helps remove toxins out. And when your lymphatic system is blocked, now pathogens and infections can spill out and really cause trouble throughout the body. And then nerve transmission, we obviously want nerves, freely moving and freely conducting, so that whatever end organ is there for that nerve, that the function of that organ is fulfilled because these nerves are working. All right. This is something that's true. 90% of chronic disease, whatever chronic disease it is, chronic disease often stems from inflammation. And the #1 cause of chronic inflammation in the body, no doubt, are these toxicities. And we'll get into more specifically what they are. But, a lot of this inflammation is from the gut. Um, and so when you start talking about improving inflammation, I know we're talking about the prostate and the bladder function, but anytime you're going to address inflammation, the gut has to be addressed because the gut is so important in regulating body inflammation. So we talk about our body in general, these cells, there's lots of cells in the body. The body has 30 trillion cells. 40 trillion bacterial cells. We have more bacteria in our bodies than we do normal cells. And the reason we don't just, blow up and become a ball of infection is because our body is naturally made to prevent overgrowth of bacteria. It's only when that delicate balance is put off is that's when the body is now at risk for all these increasing risk of newer infections or infections that now become predominant and chronic because of this loss of homeostasis within the body. And again, one of those triggers that triggers the body to start producing these abnormal bacteria are these toxicities. So we talk about, different health models. We've been living in a world where this traditional health model has been the norm. I believe things are changing. Oh, and again, over the next few years, I think you'll start seeing a lot more of prevention, looking at performance and getting to the root cause and really trying to fix why these cells are not functioning correctly. Now, the traditional model oftentimes treats symptoms. It uses drugs or surgery. Traditional model is one size fits all. It's reactive. It emphasizes genetic predispositions, which, the old model is, your mom and dad had this genetic problem, so therefore you're stuck with it and you just have to live with it. Now, the newer holistic model, it emphasizes epigenetic control, which means you can change the way your genes are expressed by making some behavioral changes, by improving your body, cleaning out your body, cleaning these toxicities out of your body. Oftentimes is something that can now help these genes function better. We take a holistic approach, and as opposed to focusing all of our energy on just one organ like the bladder or the prostate, we look at the whole body and we try to improve the whole body, get the whole body moving so that get the whole body, functioning better, so that the whole system functions better. The holistic model is also customized and personalized. Again, like I said earlier, everyone needs something different. Everyone has a specific situation that needs addressed, and everyone needs something different. And so a personalized solution is often what is necessary. All right, so we'll talk a little bit about a worst case scenario case. This is Jose. Jose is a friend. He's 41 years old. Jose urinated every 20 or 30 minutes every day and every night for about 10 years. He was diagnosed with interstitial cystitis. He was miserable, just absolutely controlled by his bladder day and night. He spent over $150,000 on healthcare. Nothing helped him over this 10-year period. He was on countless medications. He had pelvic floor rehab. He had behavioral and dietary changes. He was really doing everything he could to improve this situation. He even had what's called neuromodulation, which is interstim. He had posterior tibial nerve stimulation. He underwent a TERP, which is where part of the prostate is opened up so that channel can flow. And then he also had Botox injected into his bladder for these bladder spasms. None of this stuff worked. And so he just continued to struggle and struggle and struggle. Essentially, he got to the point with urinary frequency, urgency, and chronic bladder and pelvic pain that he had one option left, and that was to have his entire bladder removed and create an ostomy, where a piece of small intestine would now be pulled up to the abdomen and he would urinate out of a bag. And that would be so that he wouldn't have to urinate so much. and also possibly help his urinary pain. So, definitely an extreme example. So he had some choices to make. Was he going to have this surgery? What was he going to do with this issue? And Jose was found to have a large degree of mold, and it was mold that was the triggering event that was causative in almost all of his urinary issues. It took some time. This wasn't something that he was able to, take a mold medicine or something that quick to fix. He had to detox from mold and allow his body to naturally pull this stuff off and rid it. And it took about 9 months. But over that time, his urinary symptoms resolved. He had increased energy. His gut microbiome was rebalanced. He had resolution of brain fog. He had resolution of his pain. He came off his medications. And ultimately, he got freedom from what he thought he would have to live with. And again, modern medicine really couldn't help him because modern medicine couldn't get to that root cause of what was triggering all these issues. The why was he urinating frequently? Why was he having pain? It didn't get to that level. And again, mold was the identifying factor. We know mold, it produces things called mycotoxins. Mycotoxins are chemicals that are toxic to the body. They affect nerve function. They can cause nerve cell death. They can affect cellular function, and they can inhibit a hormone called antidiuretic hormone. And so when you inhibit antidiuretic hormone, now you start urinating frequently. Your body starts producing all of this urine. And again, it's because of this mycotoxin that was inhibiting this hormone, causing him to urinate all the time. And then the mycotoxins were, again, causing cell death, causing his cells not to function correctly. The pain of his was coming because his cells could not produce energy, and they switched over from an oxidation to now anaerobic glycolysis, and the buildup of lactic acid was started, and that's what caused a lot of his pain. There was no quick fix. He committed to a personalized program to address improving his cellular health. He trusted the process, and he got better. It takes time. Again, it takes time to heal. Real healing does take time. So you can do the same. I mean, I don't expect too many people on this call to have the extreme symptoms that Jose had. But whatever your issue is, if there is an underlying toxicity that is triggering your symptoms, triggering your cells not to function correctly, you are no different than him. You can improve your health, improve your wellness, improve your urinary health when you are committed to a process. Reversal of disease is always possible. So you might be asking, why hasn't my doctor talked to me about this? And honestly, it's a lot because doctors don't know about this stuff. They haven't been trained on this stuff. In my medical school, I think we had one course on nutrition. This is not something that is really pushed at the forefront of importance, and doctors really knowing this stuff and knowing how to help people that have these issues. So there's many factors to that, but that's one of the big reasons why your doctor, he probably won't talk to you about it. He won't know much about it. He won't know much how to fix this, because he's dealing with a toolbox or a tool bag that has medicines and surgery. And so, he's going to pull from that toolbox to help you with your issue. And if all he has is medicines or surgery, he's not going to use this type of thinking and this type of way of helping. So how much time will this take? Sometimes it takes a few months. Other times it may take, longer months, depending on what the issue is. Jose's example is an example of someone that it took him a long time because he had a significant issue. So it takes time. Everyone is different. And then, is it going to be expensive? This is something that's not typically covered by insurance. It's not covered by Medicare. So it does cost money. Unfortunately, it doesn't have to be expensive necessarily, but it does cost money. Because again, it's preventative, and insurance and Medicare will not pay for preventative services. So 3 keys to success when looking at this new model of medicine: you got to be coachable, willing to take action, focus on progress, not perfection, trust the process. Real healing does take some time. You can do it. There is hope. I don't care what issue you have. There's so many things, there's so many different situations that can help you, whether it's, trouble urinating, or erectile dysfunction, or recurrent infections, chronic prostatitis, interstitial cystitis, or even healing from a diagnosis of cancer. A lot of cancers can be triggered by a lot of these toxicities. And so again, if we can get to the root of why these cancers are being triggered, this can be helpful to taking out and improving that root cause so that guys are living healthier, longer lives. So we look at chronic urologic disease, the prevalence in the United States. This affects a lot of men. A lot of people are affected. So when you talk about BPH, or benign prostatic hyperplasia, this affects about 40 million men in the US. About 60% of men in their 60s will have some form of growth of that prostate that then causes some type of urinary issue. And again, that happens for a lot of different reasons. And it affects a lot of men. Overactive bladder, likewise, it affects about 33 million people. A lot of times this is women more than men. But when these issues happen, it just tells you the bladder is not functioning the way it should. The prostate is not functioning. There's a cellular problem going on, and the body is not functioning as it should. So again, erectile dysfunction, it affects 30 to 40 million men. Chronic prostatitis affects 2 million men. And then prostate cancer, 1 in 7 men will be diagnosed with prostate cancer over their lifetime. And then 1 in 2 men will develop some form of cancer throughout their lifetime now. And again, our goal is to reverse disease and improve the health so that we don't have to go through and deal with these chronic issues. There is the ability to reverse disease through, what we call epigenetics. Your body is powerful and capable of healing. All right, so progression of disease. This is a picture. I drew this. Oops. This is a picture, what it shows is an end-stage urinary system. The kidneys up top, they've lost their parenchyma, or the good part of the kidney, because the kidneys are not draining. The prostate is blocked this entire channel. The bladder has now lost its ability to squeeze and function appropriately. And again, the kidneys cannot drain because the bladder is staying full. And so again, this is end stage. This is what we want to prevent. When you get to a situation like this, oftentimes surgery is often the only thing that can be done, because it is end stage. Oftentimes someone like this would need a catheter for an extended period of time, again, because the bladder's not functioning. It's lost its ability to function. And again, if we can catch this situation earlier, start improving things earlier, improving health earlier, I believe we can reverse some of this disease that happens later in life that men have to deal with. So we'll talk a little bit about how to optimize your urinary system. And the goal with reversing chronic disease is focused on cellular health. You're having urinary trouble, number one, because your cells are not working the way they're supposed to. They're not working how they're supposed to. So whether they're prostate cells, bladder cells, nerve cells, they are not working. And again, oftentimes these toxicities and nutrient deficiencies are at the root of the problem. So our goal in any kind of improvement is we want to reverse poor cellular health. So cells, they're the basic building blocks of life, nothing more important than your cellular health. And your cellular health, it essentially determines how well your organs function. This is a picture that I drew. Again, it just shows the brain, the spinal cord, the nerves. These are the prostate neurovascular bundles. You know, when someone has radical prostatectomy or surgical removal of the prostate for cancer, these nerves are carefully dissected because they know, the surgeons know that any kind of injury to these nerves can cause debilitating erectile dysfunction. And so we preserve these nerves, but oftentimes when we look at bladder health, the nerves above the bladder, these pelvic nerves, the spinal cord, and the brain, if there are any issues that are affecting those nerves, no doubt those can have an impact on how the bladder and the prostate function. So nerve function is important. So bladder function, when you look at how the bladder functions, you want optimal nerve transmission, pelvic nerve transmission. You need an intact brain and spinal cord. You need retained bladder muscle function, and ideally you want an unobstructive outflow of urine for optimal bladder function. So what is the problem? You know, we talk about these urinary issues, you know, chronic prostatitis, chronic bladder, chronic pelvic pain, recurrent infections, frequency, urgency, nighttime urination. These are symptoms. What oftentimes in traditional medicine is not addressed is looking underneath the surface. You know, this is a picture of a glacier, and underneath the surface, what is causing all of these issues? Why are men having these symptoms? Yes, medications can be done to help with the symptoms, but why are they happening in the first place? And oftentimes, again, underlying toxicities are causative. What are some root causes of urinary dysfunction? So we're going to get into the specifics here. There's two main categories of root causes of urinary dysfunction. One are irritants, or things that irritate the bladder, cause the bladder to spasm and contract. And then there's inhibitors, inhibitors of bladder function or inhibitors of nerve function. Again, these nerves are so important in preserving so that your urinary system functions the way it should. So, you know, when you talk about irritants, we know, you know, caffeine, alcohol, citrus, spicy foods, acidic foods, and carbonation. We know those things cause irritation, but there are so many other chemicals and toxins that can irritate the bladder and cause, you know, issues in a similar way to these other irritants. So some of these irritants are other bacterias, other viruses, yeast and fungus, even something like parasites. You know, it's estimated that about 60% of Americans have some type of parasite. So it's much more common than you would ever imagine. We think, you know, because we live in the US, we don't have something like this, and that this is only in other countries, but parasites are an issue. You know, schistosomes, they affect 265 million people around the world. Schistosomes are known to congregate in the bladder, and it's one of the risk factors for bladder cancer is schistosomes. So, you know, parasites can play a part. Then you got mold and mycotoxins. Mold is much more common than you would think. There's estimated to be at least 45 million buildings in the United States that have unhealthy levels of mold. But you don't just get mold from buildings. You can also get it in your food. Things like peanuts and coffee, cereals, wine, dried fruits, beer, grape juice. things like that are common things that have mold. And even mold can be something that can be difficult to detoxify from. 25% of the population has a genetic defect that doesn't allow for the proper breakdown of mold. So they can have more difficulty clearing mold than someone with an intact HLA-DR gene. So there's also chemicals, things like plastics, pesticides, and herbicides. There was a recent study that just came out that looked at about 2,000 urine samples, and it showed that 80% of the urine samples had detectable cancer-linked herbicides in them. So no doubt these herbicides can actually be an irritant to the bladder. There's organic acids and heavy metals. There's home products that are, endocrine disruptors, things that lower our testosterone in, like fragrance products, like candles and detergents, fabric softeners, aerosol sprays, and trash bags. And then parabens. Parabens are known to be carcinogenic. And then obviously some pharmaceuticals also can cause irritation to the bladder. When you talk about other food sensitivities, now you're adding like fake sugar, artificial colors, artificial flavorings, preservatives like MSG. These also can be known irritants to the bladder and cause bladder irritation. So, our environment, no doubt, it's full of harmful chemicals. Everyone is around it. We all have different chemical loads that no doubt can affect our bladder's ability to function correctly and function in a stable way. So that's the first part, where these irritants. Now we talk about inhibitors. And these are, again, things that cause the bladder not to squeeze properly. So, or they interfere with nerve signal transmission. Those two things, that's what makes up these inhibitors. Often your nervous system is what will often determine how well your urinary system functions. Your nerve system is so important in preserving so that your urinary system functions properly. So when we talk about root causes of inhibitors of nerve function, infections and certain autoimmune conditions, micronutrient deficiencies, you need certain micronutrients for these nerves to function appropriately. And when those deficiencies are gone, now you can have nerve problems that can develop that can affect, again, the communication between the bladder and the brain, to cause urinary issues. Diabetes or insulin resistance, certain medications, brain, spinal cord, nerve root compression, heavy metals, no doubt can inhibit. Heavy metals are known to be neurotoxic. And so when you have something like that, no doubt that can affect the urinary system's ability to function when you have an overload of these heavy metals. And then the microvascular supply, the nerves rely on an intact, functioning microvascular supply, blood supply. And when that is decreased, nerves can atrophy and not function correctly. And again, that can alter how the bladder functions. And then mycotoxins, again, we talked about it earlier, but these mold produces these mycotoxins, and these mycotoxins are known causes of neuron cell death. They cause what's called apoptosis, which is cell death of these nerves. They also can cause endothelial damage or lipid peroxidation. They also can cause decreased nitric oxide production, decreased, mitochondrial function, and they can contribute to leaky gut and be a source of inflammation. And then radioactive elements, we're always around all types of toxins like this that no doubt can affect our cells. And when they affect our cells, our body can have a result. So 94% of the population is deficient in critical nutrients. having these nutrients is so important. And again, so many people are deficient, which again can play a part in how your body and urinary system functions. We kind of touched on that. This is talking about the importance of preserved microvascular function of these nerves. And when the microvascular function is decreased, your nerves will shrivel, your nerves will atrophy, and there's not as good of communication with the nerves and the urinary system. Then we have inhibitors of bladder function. What causes the bladder to not function? So we're talking about outlet obstruction like BPH, prostate or bladder cancer, bladder stones, urethral strictures, vesicle neck contracture, posterior urethral valves, a lot of different things that cause blockage of that outflow. But this is why you would be seeing your urologist, to open that channel if there is truly obstruction there. Other inhibitors of bladder function include, poor nerve communication and transmission, like we talked about. Again, micronutrient deficiency, toxicities like heavy metals and mycotoxins, like we talked about. And then certain medications like antihistamines and certain diabetic medications, pain medications. There's a lot of different medicines that can affect bladder function. So we talk about keys to optimization of bladder health. We want to optimize your cellular health. We want to identify and eliminate irritants and inhibitors. We want to improve blood flow, improve nerve transmission, improve lymphatic drainage, improve oxygen delivery, and essentially improve the body structure. As your structure of your body improves, the function internally oftentimes improves as well. So we'll talk about some easy wins for you to take home today. The waste systems of the body, again, these are so important systems: the colon, the liver, the kidneys, the skin, and the lungs. The colon is number one. Constipation is absolutely critical when you are looking at ridding your body of toxins. If you are constipated, your body simply cannot remove these toxins, and these toxins can sit in this colon and be reabsorbed into the bloodstream. It can, that alone can cause skin issues and irritation, chronic inflammation, all this stuff. So, constipation is something that when you are looking at urinary health, you have to look at having some type of bowel plan or making sure your bowels are moving regularly. Balancing your gut microbiome is so essential. You want to stay hydrated with good quality water, filtered water or distilled water, preferably. And the goal is 1 or 2 soft bowel movements per day. That's normal to make sure this system is moving. Oftentimes with urinary frequency, one of the mainstays of treatments is anticholinergic medication, things like ditropan, Detrol, Vesicare, Enablex, Inctura, all these different medications, which may help with the frequency. But now one of the downsides is that they cause constipation. So, the constipation can now allow these toxins to build up more and can actually make your urinary issues worse. So constipation is important to get a handle of when you're trying to improve urinary health. Food, no doubt, food is so important. Food is medicine and medicine is food. You hear it all the time and you can't say enough about it. I'm still learning all of this stuff with you and making changes in my own diet and own health to really get a better grasp and improve my own health. So when you're dealing with inflammation, there are certain foods that can trigger inflammation. A lot of acidic foods can do it, like oranges and grapefruits, lemons and pineapples. Vegetables, acidic vegetables like tomatoes. Tomatoes are typically great for prevention of prostate cancer because they have lycopenes. But if you have inflammation, sometimes that tomato can trigger the inflammation and be, worse on you. A lot of these pickled peppers and sauerkraut and all this stuff also can be irritating to the bladder and the urinary system. Processed meats, because they have nitrates in them, they can also be irritating. Soy foods can be irritating. And then dairy products. We know dairy is one of the most inflammatory products out there. So if you're dealing with inflammation, dairy is one of those simple things just take it out of your diet, go on a break for a while, and then reintroduce it oftentimes just to see if that's truly why you're irritated. A lot of beverages, alcohol, coffee, tea, caffeine, carbonated drinks, all that stuff can no doubt cause more irritation. And then food additives like MSG, preservatives, artificial sweeteners, those types of things can also cause inflammation. So what is great to eat? Fruits and vegetables. You hear it all the time. Everyone's talking about it. Eat your fruits and vegetables. And it has to do with, because these things have fiber, but also they have nutrients in them that help your body function normally. Lean proteins, nuts, herbs, and spices. These are all things that are helpful to decrease inflammation. Let's see, cooking oils. Oils are no doubt one of the biggest triggers for inflammation in our body. You have to be careful with what oils you're eating. Bad oils and things to avoid are things like soybean oil, canola oil, corn oil, vegetable oil, and cottonseed oil. Replace those with coconut oil, extra virgin olive oil, avocado oil, and sesame oil. So we'll talk about, how I can help. Bladder Health Signature Program. This is, again, it's a complement to your current urologic care. It's not a replacement for your doctor. It's something to come alongside and help you improve your cellular health so that your body and your urinary system is optimized. How do we help? We help through a program, a program of discover, optimize, and excel. Again, real healing does take time. And because everyone's situation is different, a personalized solution is really what is necessary. So in our discovery part, what do? We learn about your issues. So there's intake forms. We learn about your issues. We learn about your history. We learn about your symptoms. We learn about your body systems in areas of concern. We get on a Zoom call, and we take a deep dive, a 45-minute consultation where we, again, go through these issues. We answer your questions. And then we order lab work, typically advanced lab work that your doctor, I promise you, your doctor will not be ordering this lab work because, again, it's something they don't do. And so advanced lab work is done. We then go over the findings. We review your lab findings. We set some goals together, some health goals, and then we develop a personalized plan. And this is where this optimization comes in. We really help you understand your condition. A lot of it is through education. So, if you have interstitial cystitis, we go through and we talk about interstitial cystitis. We help educate you on what that is and how you can improve your health with that diagnosis. And then we're going to improve what's going in your body. We're going to identify and eliminate body toxicities that have been identified on your blood work that are elevated. And then we're going to replace micronutrients and nutrient deficiencies. And we do that a lot with evidence-based supplements that, again, are all natural. And this is the beauty of all this. These are not pharmaceuticals. These are not medications. These are all natural supplements that do amazing things in the body. And this is what healed me. This is what helped me, are these natural products that, again, I cannot say enough about. I feel like I did when I was 20. My energy level is up. I'm able to do more, function better, and again, it didn't happen because of medicine or whatever. It happened because of these natural products, something that I really was very doubtful and very hesitant that these things would help me, but sure enough, they helped amazingly. And then Excel, we teach you how to maintain and elevate your health goals through this program. So, if this is something that you would be interested in, you want to learn more about it, you want some more information, then, just please type your name in the chat, put your full name, put your email. If you're interested in hearing more about this program, you want some more information, you want someone to reach out to you and explain it or answer questions that you may have about this program that we're offering. And then common questions, the biggest question we get asked is this covered by insurance? And again, we've talked a little bit about that, but insurance and Medicare will not pay for preventative services. So no, this is out of pocket. So, it is not covered by insurance. That's probably the most common question that we get asked. And then questions. So let's see. So any questions? If anyone has a question, we got a couple minutes on here that we can still, where we can answer your questions. Any questions? Any questions? Any questions? Anyone have any questions that we can answer? All right, we got a question. So someone asked, why at night do things slow down? In the daytime, things are good, but at nighttime, things slow down. So, one of the things I've always told people is that, when you lay down at night, a lot of times there's increased blood flow. So your kidneys start getting more blood flow at night. A lot of the fluid from your extremities will be mobilized. And so a lot of times you'll make more urine at night. And so if you're noticing a slowdown or a decreased stream at night, a lot of times it's because your body is making more urine. And that bladder muscle is again, it's just having some trouble emptying. So, without knowing too much more than that, I mean, that's pretty good. I'm glad you're not having daytime issues. But no doubt there's no doubt that guys often say that a lot of their issues are at night. And not to say that you have mold issues or whatever, but when someone is getting up 3, 4, 5, 6 times at night, that's probably the first thing I would look at, is something like mold, because mold can inhibit that antidiuretic hormone, cause you to make more urine, and cause these issues. So I hope I was able to answer that. And then how do you check for mold? It is a urine test. It's usually a 24-hour urine collection that you collect your urine, and then it's sent off to the lab, and we actually find out, hey, is this which one of these toxins is elevated? Is it mold? Is it plastics? Is it is it parabens or phthalates or whatever it is? We find out exactly what that toxin is, so then we can target it, target having this removed. So another question says, I suffer from ED after a prostate implant seeds. At night, I get up 5 times at night. I had a urolift 3 months ago. So ED after a prostate implant, I'm assuming that you're talking about like brachytherapy seeds. And that unfortunately is something that can happen. I want to say the rate of erectile dysfunction after brachytherapy is somewhere around 30 to 50%, something like that. And a lot of it has to do with, these seeds release radiation. Radiation can affect how the nerves function, because it affects, again, that vasculature. So You know, there are things that you can do to improve your erections, even naturally with natural products, to help with that. You know, just because you had those radiation seeds put in, there's still a lot that you can do to improve that situation, again, naturally. And then getting up at night, you know, 5 times a night, that's a lot to be getting up. I know if I did that, I'd be worn out, I'd be tired. So I hear what you're saying. And says you had a Urolift, which, you know, is one of those things that's often done after radiation or after brachytherapy, you know, to open that channel. But after a Urolift, your channel really should be fairly wide open. So if you're still having trouble, again, I would look more towards there being some type of bladder issue or a nerve issue. Something may not be allowing that bladder to really squeeze and function the way it should. And again, anytime there's an issue with the bladder, we look at toxicities to see if any of those toxicities are triggering either these nerves to not work or the bladder not work right. You know, especially because you had that Urolift, and again, your channel should be open. So I hope that answers your question. All right, thank you for that. All right, so if you want some more information about our bladder program this year, you want to know more about it, you want some more information, again, type your name in the chat and say, I want some more information, and we'll make sure we get you that information to hopefully help. Our goal is to help people with their urinary health, help people that wouldn't normally get help with traditional ways, or, you know, a lot of times you've exhausted all those measures, and often doctors can't do anything else. So this is something that can really optimize your health and optimize your urinary system. So if that's something you want, again, put your name in the chat below, and we will get you some more information. All right. Yeah, your name and email, if you would. And we'll just give it a few more minutes to make sure we get that. But again, so much to offer. Again, this is something that I'm passionate about, and I really believe it will help so many guys, again, that are not getting help with traditional ways of treating their issues. Again, our goal is optimizing their health, optimizing your cellular health, to get you feeling better and functioning better. So very good. All right. We will send you guys an email. Hey, thank you guys for watching. We're also on YouTube. We have a YouTube channel that has free videos. We talk about prostate cancer and BPH and erectile dysfunction. So if you want some free videos and some information about that, look for it on YouTube. Type in the Prostate Coach on YouTube, and you can get a lot more information there. And again, thank you for being here. Thank you for listening. Thank you for spending some time, and just thank you for being here. Have a great night. Mm-mm.